And joining me now, the president of Pfizer Canada, Cole Pinnow. Nice to see you, Mr. Pinnow.
Hi, Rosemary. Thanks for having me.
So obviously on Friday, the Prime Minister gave us some good news that we are going to be getting a lot of vaccine from your company for the foreseeable future. Can you assure Canadians, though, that the interruptions, the disruptions that we have seen already over the course of the past couple of months are now over?
Yeah, I understand the concern that a lot of Canadians have, but I want to remind everyone that when we communicated the disruption in delivery, it was purposeful, that we were making upgrades to our Belgium manufacturing facility with the intention of being able to increase our global capacity from 1.3 billion to 2 billion. And now that that work is complete, we were happy to share on Friday that we were able to pull forward or accelerate the delivery of doses for Canada, moving 9 million doses that were originally scheduled to arrive between October and December into both the second quarter and third quarter.
What happens if you miss the targets? Things can happen, right? Unpredictable things can happen. Does your company then have to pay any kind of penalty to the Canadian government?
Well, I understand one of the concerns is around the delivery schedule and why Pfizer has committed on a quarterly basis as opposed to a weekly basis. And part of it is, as you mentioned, is the unpredictability week to week and sometimes month to month about scaling our manufacturing process from where we were when we originally signed this contract back in the August timeframe to where we are today.
So are you saying that you wouldn't miss these deadlines? Is that what you're saying? Because you're not answering me around the penalties. So are you saying you just don't think it's fathomable that you will actually miss this deadline for Canada?
Pfizer is extremely committed to meeting its contractual obligations, and we have every intention of meeting the 4 million commitment by the end of March that the Prime Minister has been talking about, and then this 10.8 million between April and June, and now the 25.2 million between July and September. So, as long as we're honoring our contract, we don't really feel that it's value add to talk about hypotheticals.
Okay. I know that it is a contract. I was speaking with Minister Anand last weekend and asked her why we can't know a little bit more about the contract. She made it clear that she was going to go to the various companies and ask for disclosure. Have you committed to allowing the federal government to disclose some elements of the contract?
Yeah, so, we're sharing the delivery schedule, which I appreciate is very sensitive to Canadians, and that is part of the contract. So we have mutual agreement with the government to disclose that element. But there are other parts of the contract which are extremely sensitive. There's commercial implications and also geopolitical implications to some of the details that are in the contract. So it's really in all of our best interests to operate under the spirit of the agreement. And again, we're committed to meeting those obligations.
Okay, so does that mean that we will never know how much we paid per dose, as we do know in some countries?
Yeah, at this time, we really feel that it's best to focus on delivery of these vaccine doses and making sure that all of our frontline stakeholders have the proper tools, techniques, training, and materials necessary to receive this large influx of vaccine that we're anticipating shortly.
Right, but if you agree to that in the United States, why can't Pfizer disclose that here in Canada? Is it the federal government preventing you from doing that?
No, this is really, again, our commercial interests and the geopolitical interests. So we're really focused.
Yeah, I'm not sure I quite understand, though. We share a border with the United States. So what are the geopolitical interests that are different for Canada?
Yeah, and again, I think it's not just Canada. It's really, if you look in totality, Pfizer is contracted with over 50 different countries. And there are 7 other vaccine suppliers that I know Canada has contracted with. So we're talking about hundreds and hundreds of different contracts that are out there. And all of those are working on a global supply network. And as far as I'm aware, there's only a handful of contracts globally that have been disclosed. And I think, again, most countries recognize the sensitivity around those contracts.
You spoke about, we were talking about the United States. I'm glad you brought it up because, of course, you have a large plant in Kalamazoo, Michigan, which is, as you well know, is not very far from the Windsor-Detroit border. All of our doses, though, are being shipped from the European operation. In November, I'm not sure if it was you or someone in the company, did tell the Globe and Mail that Canada would be receiving doses from the plant in Michigan. Why did that change? Was it directly related to the presidential order at the time that no longer allowed you to ship them out of the United States?
Back in November, we were working to accelerate the delivery to Canada of vaccine based upon the accelerated review process that Health Canada had put in place.
Yeah.
And so as part of that, we reevaluated what our supply chain plan was going to be, and we determined that sourcing from Belgium was really in our best interest, at least through the first half of 2021.
And why was that?
Well, as you mentioned, there was some uncertainty with the prior administration, and so we wanted to have confidence in where we were sourcing the product, and we felt that Belgium really provided us with more certainty at the time.
Once the United States is vaccinated, will you open up those parameters, I guess, and allow those doses to be sent elsewhere?
At this time, we haven't made a determination on where we're going to source beyond the first half of this year. So we'll certainly consider all options as we evaluate the situation going forward. But that doesn't change the commitment we're making to Canadians that starting next quarter, between April and June, they'll receive 10.8 million doses, and July to September, they'll receive another 25.2 million, which will bring the total delivered doses from Pfizer at 40 million, which is a pretty astonishing number of vaccine.
Right, but if I'm not mistaken, I believe you're providing 300 million doses to the United States. So, I mean, some people could look at this in Canada and think that you are actually prioritizing Americans over Canadians.
The 40 million number is really determined by the government. They have the option to pursue up to 76 million, I believe, somewhere in that range.
Yep.
And right now, as they've asked we went from 20 to 40 at their request. And we're always open to talking about incremental demand or incremental supply if that's what they feel are in Canadians' best interest.
AstraZeneca has said it will not make a profit from its vaccine during the pandemic. Where does Pfizer stand on that issue?
So Pfizer really believes in the value of innovation. We're very proud to have been the first vaccine producer to bring a COVID-19 product to the world. That came at tremendous investment and financial risk to Pfizer. And so, in order to encourage innovation, we believe there needs to be a tangible reward to incentivize that innovation. And so we have a different business model that we've been pursuing.
And how much profit do you stand to make during the pandemic? Do you have an estimate of that?
I can't speak to that.
I just want to go back, and I'm sorry to belabor this. I'm just going to go back to the contract issue just before I let you go. Just so I understand clearly, is it that you don't want to release details, or the federal government doesn't want to release details, or is it both, that neither of you see a benefit to releasing any details in your contract?
I think both the government and Pfizer recognize that there are commercial and geopolitical sensitivities to releasing details in the contract. And so at this point, we're both honoring the contract, and there really isn't the need to release those details.
Is there a world in which you could be producing even faster? Could those delivery dates move again? Could they be moved up again?
We're going to continue to look for opportunities to accelerate delivery. We recognize that we want to bring as much vaccine to Canadians as soon as possible. So we'll continue to evaluate the situation and look for opportunities for acceleration.
So it's not out of the realm of, it's possible. It's something that we should consider.
It is possible, but right now, given that we made this announcement on Friday, I think we should focus on the scale up that's going to occur from 4 million at the end of March, 10.8 million at the end of June, and 25.2 million at the end of September.
Well, you know those numbers better than I, Mr. Pinnow, so thank you for saying them. I appreciate your time very much this morning. Thank you.
Thank you, Rosemary.